This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. We're delighted you're with us today. And as all of you know, we have great topics that we discuss on this show. And we're going to do a follow-up on AFib. And what a delight. We've got Mark Cuban with us. And I don't even have to introduce Mark. He's well known throughout the nation, but especially here in North Texas. Mark, welcome to the show.
Thanks for having me. I'm excited to be here.
So let's just jump right in. How did AFib show up in your situation?
I was at a nightclub and I was drinking Red Bulls and I had a heavy sweater on, and all of a sudden my heart just went bananas. And I was like, oh my God, I'm going to die. I think I'm going to die. And so I took off my sweater, got a t-shirt, went off and just started walking and walking and walking. And fortunately, my first episode only lasted about 15 minutes, but it just freaked me out. But that was the first time. And that was probably 10 years ago.
Wow, 10 years ago. Well, that's when it first occurred. When were you actually diagnosed?
It happened again, probably not for 5 more years. And that's when I went to the doctor, because it happened twice within a shorter period. And when I went to see just my regular physician, he was like, do you drink much coffee? I'm like, every morning. Do you drink much Diet Coke? Every day. He's like, do you drink Red Bull? Yeah, I like Red Bull. He's like, well, you may have a problem, right? And so he goes, let's start off with just eliminating those and see what happens. And from then, that kind of helped me for a long time. And then it popped its head up a few times after that.
When it popped its head up and you talked to your doctor, do you think genetic, stress, weight, any factors that impacted other than the ones you just talked about?
Yeah, as it turns out, my uncle and my brothers had it. I didn't even know my younger brother had it at all until we brought it up in a conversation. And so, yeah, it's certainly genetics are definitely part of it.
Have you had any special medical procedures because of AFib?
Yes. So I've probably had only 5 real episodes. I mean, look, anybody in my situation, you'll feel your heart out of rhythm for some period of time, but then it'll click back into rhythm, right? It'll just be, and it speeds up a tiny bit, but then clicks back in. And that's happened, I don't even know how many times. But where it was extended into the minutes or hours, I'd had a couple things that happened. And then on April 18th, I think it was 2019. And I remember the date because Dirk's retirement game, his last game at the American Airlines Center in 2019 was the very next day. And it was the first time I'd gone into AFib for multiple hours, and I was freaked out. And so I called my heart doctor, Dr. Park, and he said, there's this thing called a T, I think it's called a TEE or something like that, where how you watch on television and they shock him and they put the gun, they put the electrodes on his chest and you see him bounce in the air. Well, that's right. What it is. And they do that to try to get you into rhythm. And so at 6:00 in the morning, the day of Dirk's retirement and his last game at the American Airlines Center, actually, I went and got my heart shocked back into rhythm. And other than 2 times since then, it stayed in rhythm.
Well, I'm glad it stayed in rhythm. And I was going to ask you about that. With your busy schedule, and especially Shark Tank, when a lot of filming goes on, do you have to take special breaks, or are there some time constraints?
No, not really. I mean, I work out a lot. I really try to stay in shape, and I've really changed my diet a lot. When the younger you are, the less impact all the garbage you throw in your body has. And as I got older, it became really obvious that all these things have an impact. And so I really became a vegetarian right at the same time. I became a vegetarian, and I've really been strict about my diet for the most part. I got 3 kids, 11, 14, and 17, and avoiding all their junk is beyond my capabilities. But, I've really tried to be smart about it, and that's really made a difference.
You know, I heard a portion of a podcast you were on, and you said you felt fortunate that your AFib was not like some other people's. Have you had to deal with blood thinners or any other special medications?
I was on blood thinners for a while, but one of the things I do, I try to go and get my blood tested every 6 months or so, just to see if there's any markers for any inflammation or stuff like that. Just so I have baselines, and I don't necessarily recommend that everybody do that, but I can afford it. And my doctor, after seeing all my blood work and taking my stress test and the nuclear stress test, said that just taking the little baby aspirin every day was enough.
You know, you mentioned throwing back the Red Bulls and some of the food we put in our bodies when we're young. Has this changed your perspective on other chronic illnesses?
Yeah, absolutely. I mean, I always used to scoff at people who said food is medicine, and now I 100% believe it. And I think just the reality of our bodies, they were designed in a certain way, and they're very forgiving when we're younger. And just as nature is, as we get older, it's less forgiving. And we need to be much more careful, because everything that we eat or don't eat, and every time we abuse our bodies, it takes its toll. We don't bounce back the way we used to, and so I really try to watch my diet, stick to the RDA recommended allowances, make sure, now I eat total cereal in the morning so I get enough iron, and I have my fruit so I get my vitamin C and my B12 and my vitamin D. And I don't want to say I've taken it to the level of a sickness, but I record everything in an app called MyFitnessPal, and it shows the nutritional information, and it really helps me stay a little bit smarter. And at least when I pig out or do something stupid and have a few too many drinks, at least I know, how to get back in balance.
Mark, I wanted to ask about stress. I mean, yes, diet affects our heart rhythm, but also stress, huge. What do you do about stress?
I go out and shoot baskets. There's two things I do. I go out and shoot baskets, and I yell at referees. That's what I do. Anybody who knows me, they're like, that's not you, right? They know I'm competitive and they know I can be loud. But when I play basketball, and over the years when I've played in leagues, I'm not a referee yeller. But at a Mavs game, for whatever reason, that's where I get out all my stress. I'm screaming and yelling the whole time.
Is that really a release for you?
Oh, yeah, absolutely. Everything that's inside of me, I'm taking out, and it's getting out and scream. Because the games probably in my life, other than the health of my kids, who are 11, 14, and 17, something every parent goes through. Other than that, Mavs games are probably the most stressful part of my life. And that's a good thing, I guess, relatively speaking. If that's where your stress comes from, then things are going well. But yeah, so that's where I take out my stress and experience most of my stress.
All right. So you're driving to the arena, you're feeling it. Over the next 3 hours, it comes out, and then you drive home a happy guy?
If we win. If we lose, then, I've gotten better. My kids really changed. Before my kids, I was a mess for 2 days after we lose a game. But now, 21 years in, I've kind of gotten a little bit, I don't want to say used to it, but better at accepting it, because my kids would just get mad at me. Why are you so cranky? And And so I had to overcome that.
Yes, this is the Mark Cuban here on the Human Side of Healthcare, talking about atrial fibrillation. We're going to continue the conversation next. Stay with us.
This is the Human Side of Healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back. We are talking to somebody who needs no introduction in Dallas-Fort Worth, Mark Cuban, Dallas Mavs, Shark Tank. And why is he on the Human Side of Healthcare? Well, about 10 years ago, his heart started beating arrhythmically. It's called atrial fibrillation, and he's talking openly about it, including some of his other health ventures.
I'm going to pivot just a little bit, and thank you for being so open about your AFib and being a celebrity like you are. I hope our listeners take this to heart and really listen to some of your advice. But I'm going to pivot just a minute, because you have such an eye for technologies and future technologies. I think you've invested in several medical ventures, particularly related to the heart. Can you expand on that?
Yeah. First, for my personal use outside of business investments, I have an Apple Watch, which has an ECG, and so I feel out a rhythm I can record my ECG there, and that gives me a little confidence. I have one of the cardio devices, which is a little bit more advanced, so it'll do an ECG when I need it. I have a little thing that I carry around when I travel for my blood pressure. So if I'm feeling stressed, or when you're just feeling a little bit off, I can at least try to figure out what it is. Sometimes it's just being tired, but I just like to know. But in terms of business investments, there's a company out of Cincinnati called Genesthesis. And it was started by just this guy, Payush, that at 22, he was a medical doctor, just a lot smarter than me. And what he told me, and I had no idea, is that every organ in our body emits an electrical pulse. And there literally are sensors that can measure that pulse. And by taking that pulse and running it through machine learning, and by machine learning, it's a form of artificial intelligence that, after having analyzed tens of thousands of the output of these sensors, they're able to tell with about 95%, I forget the exact percentage now, effectiveness and authority, what type of problem your heart is having. And that's particularly of interest to men as they get older. As you get older, you start feeling things in your heart and chest pains, and you don't know if it's heartburn, acid reflux, a muscle pull, or something that's truly bad happening with your heart. And by going through, and let me take a step back. And when that happens, you kind of hope it goes away really quickly. And then you have to make that decision. Do I need to go to the emergency room or call a doctor if it stays? And so with the Genesthesis device, and it's just finalizing its FDA approval and being tested in various hospitals, you would go in there. It takes a few minutes for the scan, and then they can tell you with a fair amount of accuracy what it is that you're dealing with at that moment, and whether or not it's a crisis. Because otherwise, it's really difficult for a doctor to determine what exactly is going on with your heart. It's just, that's where the technology is, and this, it takes it a significant step further.
That's amazing. I really appreciate you taking the time to describe that. Now, obviously, with AFib, you're interested in things related to the heart, but just out of curiosity, do you think of other potential medical ventures you'd like to participate in to help the overall health of the community?
Oh, yeah. I mean, I'm involved in so many different things. I help fund a clinic, the Dizzy and Vertigo Clinic, that's in LA now. I had a scenario where I injured the otolith, which is in your inner ear, in your vestibular system. And from May 21st, 2015 until September of 2015, I was dizzy all the time. And I was having to take Valium to try to calm things down. They put me on Klonopin for a while, and I was like, no, get me the hell. I'd rather be dizzy. And so I went to this to see these two doctors, Dr. Pierce and Dr. Nava, and they put me in this machine that's used for war veterans who were injured and have had significant brain injuries. And what it does, it evaluates the equilibrium between your eyes, your ears, and your brain, because sometimes your brain gets out of whack. All those three things get out of whack. And I literally worked with them to invent a virtual reality program that you can look at inside a pair of goggles, and that does the realignment rather than having to go sit in one of these machines. And so we're waiting on the patent. So I think that's pretty cool. But still, doing these types of applications and trying to find ways to improve healthcare is something I'm very passionate about. And you might have seen, we announced the Mark Cuban Cost Plus Drug Company, and where we're going to be selling drugs that we manufacture and others that we import, but we're involved with the evaluating and confirming the manufacturing, and we're selling them whatever our cost is plus 15%. And we're actually building a manufacturing facility in Deep Ellum, where we can make a whole series of injectables so that we can offer all these different drugs that are way overpriced at our cost plus 15%.
Boy, that's amazing. That is fantastic, and especially doing it here locally. Thomas, I've asked quite a few questions. I'm sure you have a couple.
Yeah, thanks, Steve. Mark, I'm thinking, what would you say to people? In other words, you've lived your life very full. No secret of that. You play full out. But a doctor told me one time you can basically get away with murder till you're about 50 for a guy.
Yeah. My doctor told me by the time you get to 55, something hurts every day. And you've got to respect your body. and respect your mind and respect your time, because it does catch up with you. And I was a party machine, and I wouldn't have it any other way. I have my fun in Deep Ellum, and still know how to have fun. But at the same time, you have to be smarter about it all, and you have to be really concerned about your physical health, your mental health, and a lot of that starts with exercising. I exercise every day. When we're done here, I'm going to go work out and make sure I get an hour in every single day if I can help it at all, and really be careful with what I eat. And it's actually more what you eat than how much you exercise. And so as you get older, you really, really, really have to recognize that what you put in your body is everything. And we all learn hard lessons, but I think, I went through that period where, okay, I can afford to go out to the nicest restaurants, and, this is a special experience. And then my stomach got bigger and my health got worse. And there was definitely a connection there. And so I just decided it was time to do something about it.
Did you drop some pounds?
Yeah, and it's more, I only lost, I guess over the years, my high weight over the last 10 years or so was probably 225, and I was 197 this morning. So over the years, I've dropped pounds, but it's interesting because I'm thinner now and I'm in better shape now when I really got control of my diet and started eating more natural and getting rid of the processed foods and all that. And, went vegetarian, not vegan, but vegetarian. But I really try to limit myself to the natural foods and nothing processed and less sugar. And that really, the pounds just fell off. Well, actually, the fat fell off of me. The pounds didn't, because it was easier to turn it to muscle in the times I did work out. And so that really worked out well for me. But everybody's got to learn about their own body. But you got to respect your body.
So you're an active guy anyway, so you just tweaked the diet a little bit, didn't necessarily change the physical activity, and the pounds came down?
And I have more energy. Literally, I'm consuming, because like I said, I track everything in MyFitnessPal. And so I might, like what I had for lunch today was black beans with some green peppers and some cheese in a microwave. And that sounds disgusting to a lot of people, but my kids will tell you there's the Cuban Rule. If you like one thing and you like another thing and you combine them together, you're going to like it even more. And so that's kind of the way I think about food. So I like black beans. I like cheese. Green peppers are good. It gives me the vitamin C that I need, for my daily nutrition. And I mix them all together and I like it. And so, but all those things are natural, and all those things are straight, not packaged. And though it fills me up. And that's the whole thing. And like I was telling my wife the other day, it used to be that I'd hit 2,500 calories in a day because I track it. And then I'd have to work out to try to make up for some of the calories I ate. And now, I'll be 1,700 to 2,000 calories and be just stuffed because natural foods have more fiber, et cetera, and they fill me up more. And so I don't feel hungry at all. I'm stuffed, sometimes too much. And it's just made a huge difference.
Did you get any consultation to put this diet together, or just figure it out?
Yeah, I just figured out what I liked. Do I like this? At least I'll try it. Things I never thought I would like, I like now. I don't go out of my way to cook things like spaghetti squash. Easy to cook in the microwave. I can throw anything I want on it. I can just put cheese on it. I can put a little butter around it. I can put whatever I like, mix it all up. And there's 100 calories in a whole, 2 cups is 100 calories, and it just stuffs me. And so those are the types of things that, I can put it at a taste that I really enjoy, whether it's, cheese or whatever. I love cheese. And I don't overdo the cheese, but then if it's on spaghetti squash, I'm good. Sweet potatoes, I'll put 2 sweet potatoes in the oven, set them for 45, 450 degrees or whatever it is. They cook for 45 minutes. I dice them up real quick, or I'll just eat them like, eat them like an apple, right? Where I'm just taking, my wife's like, what the hell are you doing? But I'll just eat it like an apple and just, because it's sweet and it's tasty and it's healthy and it fills you up. A little bit starchy, sometimes I got to watch my carbs. My cholesterol is way down. My sugar, my glucose levels are way down. So far it's working for me.
We really appreciated Mark coming to talk to us about something so personal. Now, when we come back, we're going to talk to a physician who treats atrial fibrillation. That's next. Stay with us.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
And welcome back. In the first half of our show, we've been talking to Mark Cuban. If you missed that interview, it's on our podcast, The Human Side of Healthcare. Now we're going to talk to a physician who treats atrial fibrillation. This is Dr. Sumeet Chhabra. He's an electrophysiologist at Texas Health Presbyterian Hospital of Plano. Welcome back. And from a medical definition, what is atrial fibrillation?
Atrial fibrillation, we colloquially call it AFib. I'm sure a lot of our listeners know what it is or have a family member or coworker or loved one, someone that they know who has it. It's a very, very, very common heart rhythm problem in the United States and the world. It's basically when one of the top chambers of the heart having 4 chambers, instead of the electrical current being normal and the heartbeat being regular, the electrical currents destabilize and the heart rate in the top chambers goes from being a normal heart rate to being 300 or 400 beats a minute. So the top chambers are racing away. In fact, if you had a video camera on the heart or an ultrasound camera on the heart, it would look like the flash. The heart is going so fast that it looks very chaotic, and it causes the patient to have palpitations, unsteadiness. They can get shortness of breath. The blood, instead of moving through and through the heart nicely like it normally does, it just kind of gets stuck and hung up in the top chambers. People can form blood clots and have heart attacks and strokes. Very, very common problem. A lot of times people come in and they know something is wrong. They'll see the primary doctor or urgent care, or they'll call someone in the family who's in medicine, and it gets picked up pretty easily. And nowadays, actually, we have, we all wear these watches and have these gizmos that spit out to us, what our heart rate is and is it regular or irregular. So we're actually finding a lot of folks out there in the community who have one of these wearable technologies, and they're picking it up by themselves and showing up to the office.
Are there any preventive measures we as individuals can do to help prevent AFib? And then secondly, even if we do that, if we develop symptoms, when do you recommend individuals seek treatment?
In the general population, Steve, and folks who've not had COVID, there's a lot of data. We've had data for 75 years on preventing AFib. It really has to do with folks taking care of themselves, watching their blood pressure, watching their weight, sleeping well, and if they have sleep apnea, treating their sleep apnea, caffeine intake, alcohol intake. Those can negatively affect or predispose someone to atrial fibrillation. So when we see a patient who may or may not be kind of close to developing AFib or has had some irregular heartbeats, we really harp on those things. If someone is in their mid-40s or 50s or 60s, it'd be a little bit unusual, although not impossible, for them to have AFib, because typically we see it later in life in the people who are 65 and above. But then we do some digging and look for risk factors like the sleep apnea or caffeine intake or whatnot. In the COVID population, it's a little bit different because 10% of COVID patients can have AFib. More if they're in the hospital. If someone's hospitalized, the percentage goes up. But just in the community, 10% of COVID patients in general can have AFib. And I'll tell you, in the last year and a half, I'm doing a lot more folks in their 30s and 40s who had COVID, developed AFib, never had it before. We can't get rid of it now despite good medications. They beat the COVID, but the residual effect of COVID is atrial fibrillation, and we're having to take them through procedures to get them back to health.
As you look at some of the current treatments and therapies, and you've touched on some of those, as you look to the future, do you see any future developments or new things on the horizon that may come into the treatment of AFib?
Yeah, so for AFib in general, we're actually pretty advanced, for better or worse, and so many people, millions of people in the United States have AFib, and with the population just getting older, and since we think AFib really shows up in a big way at the age of 65 and above, there's a lot of, just for years and years and years now, a lot of technology and a lot of research dollars going into AFib treatment. And really, the big change right now that's happened is, I mentioned cardiac ablation, which is something that I do as an electrophysiologist and people in my field. we've become much more, I would say, aggressive about treating AFib early and treating it hard when the patient is diagnosed. And there's a lot of new technologies coming out to make our procedures much more routine. They're already safe, but even safer, make them more outpatient procedures. 10 years ago, these procedures took 6, 7, 8 hours. Now they take less than 2 hours, and we send people home the same day. And the crux of the procedure is, since we're seeing younger patients now too, is how do you get them through the procedure safely, get them home maybe the same day so they can go back to work or their family in a couple days. So really it's becoming safer, more routine, more minimally invasive, and I'm really excited about a lot of the technologies coming out to help us do these things.
Once it's fixed, all problems solved, no side effects, no residuals, or are there some residuals from having it in the first place?
Yeah, there's any procedure obviously has risks. I mean, the main risk these days, believe it or not, that we quote really have to do with just the act of having a procedure in general. There's always the going under anesthesia. There's always the meds we give. There's always the chance of, allergic reactions to something. Sometimes we have to give IV contrast, IV dye, just like people get for CAT scans. But if somebody fell into the group, that 95% group, where everything went the way it should, we're very happy, and there's really no residual bad effects. The residual effects are good effects in that the patient is fixed. It's always disheartening if the patient comes back and they still have arrhythmias and they have to get more ablation. It's disheartening for the doctor. I'll tell you, listen, like all listeners to know, it's disheartening for the doctor too, because we want our patients to be healthy. We want them, there's no better reward being a doctor than seeing the patient healthy, the family's happy, patient's happy, the doctor is very happy then. So if the patient needs more, the doctor feels like we have to get this patient fixed now. In terms of, there are some arrhythmias some people have, so this is a COVID discussion too. With COVID patients, I've noticed in most arrhythmia patients, usually there's one thing going on, just, in general, the general population. In COVID patients, a lot of times you get into the heart and there's 3 arrhythmias going on. So, those can be challenging, and sometimes you have to, get what you can get, and obviously make sure the patient is safe at all times. Sometimes with COVID, actually they have 2 at the time of the procedure, and then 6 months later a third one pops up, so that's frustrating for everybody. But I think having a good relationship with your doctor, good open discussions, patients doing their own research and coming up to us with questions. I love when patients come with me with research and questions, because it becomes more of a partnership and we can get through this together. So I think ultimately, to demystify ablation, it's really become first-line therapy in the United States.
So as an electrophysiologist, when people come in and say, well, Doc, I had my watch go off and I'm not sure about this, how valid are the watch technologies for you as a clinician?
Yeah, this is always the million-dollar question, I'd say, because now there's so many of them too, so many different brands, and there's the different algorithms, and even the same brand, there's a new model every year. It ends up being, there's only a couple of them that are really FDA approved that give very good fidelity signals in terms of the EKG that the watch or the little monitor on the phone reports. What I'd say, though, is we do use them. I mean, we find them helpful, and I have a lot of friends who are electrophysiologists around the country, and we talk at our conferences and our meetings about this. It is helpful. If somebody, has a pretty predictable heart rate pattern. Like the patient tells me, Doc, I walk or I bike or I fish, and this is what my heart rate is, and there's a break in his or her pattern, and the watch is showing the same thing the patient's feeling. Usually that's real. I mean, if the patient, before we had watches, we went with symptoms, and the patient says, Doc, I used to be able to go, fish all day and I was fine, and now midway through the day, it's hot outside, I'm dehydrated, I feel like I'm getting woozy out there. I feel like my pulse is a little fast. And the watch clearly shows that the pulse, picked up, and the patient felt it at the same time. It's real. I obviously, then this becomes the beginning of the medical evaluation, where I have to give them a, dedicated, FDA approved for medical grade use cardiac monitor. We use these really sophisticated monitors these days that are live monitors. They're cell phone-based systems. I can monitor my patient can go to the lake and go fishing on a long weekend, and I can call him while he's on the lake and say, listen, you're in something. You got to stop right now. It's happened. That's true story that's happened. So, it begins the process of discovery. And if we can discover something and help somebody and prevent a stroke, prevent a heart attack, I think we've accomplished some good here.
And if somebody has arrhythmia in general and has not had a procedure yet, I wanted to ask you about a couple of things that I've been doing that have made a difference. One is sleeping with my head elevated above my heart and my feet up at about the same level as my heart. That's one. Extra magnesium in my water, number 2, and vitamin D, number 3. Comments on any of those?
My comments are, I commend you for doing a good job on all of those. Those are all actually very good strategies. At the beginning of the call, we mentioned that, stress, so people in very, very high stress, life stress, job stress, emotional stress reduction, which is always hard, easy to talk about, hard to do in practice, but stress reduction helps. Sometimes for a patient to have an outlet, whether it's a, physical outlet in terms of gym activity or some sort of just break, or maybe their job, just they need to change their schedule at their job. That always helps. Sleeping well is very, very important. Very, very important. I can't say that enough. Arrhythmias the world over, in every study that's ever been done, if people are not sleeping well or have sleep apnea, their chance of having arrhythmias goes up, and the chance of having arrhythmias that are hard to treat goes up.
Dr. Sumeet Chhabra from Texas Health Presbyterian Hospital of Plano. Now, when we come back, we're going to talk to Dr. Robert Haley. He has a very interesting prediction about what next year might hold for COVID-19. You'll catch that next with us on the Human Side of Healthcare.
Covering the healthcare topics that matter most to North Texas. This is the Human Side of Healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. Thomas, we're dealing with COVID-19 still and the new variant. So I think we need to talk to Dr. Robert Haley from UT Southwestern again to get his thoughts as we approach 2022.
Exactly, and he is professor of internal medicine and the director of the Department of Epidemiology at UT Southwestern.
So, Dr. Haley, we're through the holidays. It's still winter. We're looking to January, February, March. What is your advice to people related to COVID in general, the Delta variant, the Omicron variant? What should we be doing to protect ourselves?
Number one, if you're not vaccinated, you need to get the full vaccination, the 2 shots. And if you have been vaccinated fully, then you need to get the booster, because over anything else, that is what will give you the most protection. We see that of all the people who have to go to the hospital with coronavirus infection through the past couple of years, almost all of them are unvaccinated. And vaccinated people, even if they get infected, one of those breakthrough infections, they don't get very sick. The second thing is, if you do get sick, even if you've been vaccinated, you want to call your doctor. You want to get tested to see if it's coronavirus. And if it is, you certainly want to call your doctor or go to a clinic and inquire about a treatment, because there are some new treatments coming. Some already here, the infusion of antibodies or the 2 new drugs that are in the pipeline. Those appear to be very effective at reducing the severity, but you have to get treated within the first 3 to 5 days, preferably the first 3 days after you first get symptoms. So don't wait. If you get a cold and you want to just quickly go to the drugstore and get one of those tests and take it, and if it's COVID positive, then you want to quickly go talk to a doctor, because there's something they can do that might save your life. Now, the third thing, I think, is we still want to wear masks when you're around other people. Even if you're vaccinated, you can get infected. And if you're infected, you can spread it to other people around you, other people in your family. If you have small children who haven't been vaccinated, they can get it, particularly your elderly relatives, your grandparents, parents who are older. Those people can get it, and even if they're immunized, some of them might not do as well as the younger people would. So So you don't want to get infected because you can spread it to others, even though you might do well with it. So I think those are the main things that we should be doing.
So, Dr. Haley, with your experience and even working at the CDC, let's look at history. The Great Influenza in 1918, started as an epidemic. Then it became pandemic. Now, flu is endemic. We get a flu shot every year. Is that what's going to happen with COVID-19, you think? It's going to become endemic?
Of course, nobody really knows. We're trying to predict the future, but most likely that is what's going to happen. In fact, if you look back at the history of that 1918, 1919 winter worldwide pandemic of influenza that occurred, that was the most deadly pandemic known to man up to then. It was really, really terrible. But what we saw is over the course of the epidemic, third or fourth or fifth wave, the virus did become less dangerous and less deadly. And I think that's what's going to happen to this one. In fact, we may be seeing it with Omicron. We may be seeing finally a little moderation of its virulence, the ability to kill you. You wonder why that happens. Well, I think it has to do with the evolutionary cycle. The reason that evolution happens, the reason that viruses and other species change over time, is to increase the likelihood that they will survive and reproduce so that their species will continue to exist. And so viruses we've seen rapid evolution, strains that become more and more infectious because the more infectious ones that appear then take over, and that's the evolutionary process. So it's in the interest of the long-term survival of a viral species for it to become more infectious. It's not in the interest of the species to kill its host. The fact that it kills a human that it infects is not good because its home dies and they die. So that's counterproductive. So we don't expect them to become more virulent over time. If anything, that they might become less virulent so that the host that they infect stays alive and allows them to reproduce more. Because the longer they reproduce, the more likely they will to produce another variant that's more infectious. So I think that's why the natural history is most likely this will eventually become less virulent. Another factor is that this virus doesn't tend to affect little children very much. It's not very severe, but it can spread in them. And so we think what happened to flu and what happened to previous coronaviruses, by the way, this isn't the first coronavirus we've seen. There are 4 others that are known that probably started out as pandemics like this. It might have been very severe, but we don't know the history because it was too long ago. And what happens is, at first they go spread around as they affect adults, and so what they kill a lot of people. But eventually they stop spreading and maybe go away for a while. But then when they come back, they first affect the children who have been born since the last epidemic. You see, but the children don't get very sick, but all the children develop immunity. So as they grow up, they are immune. So adults don't tend to die, except for the few adults who escaped infection as a child. That if they get it first as an adult, and we do see occasional galloping pneumonia that we don't understand, that we can't treat, and that may be one of these people who somehow escaped being infected as a child and then do badly. And if that's the case, then this coronavirus, the COVID-19, will eventually become an endemic one. It comes back every year or 2 or 3, produces common colds among all the children, but everybody else is already immune, and it'll join the other 4. It'll be the 5th coronavirus that causes common colds. That would be nice, and we hope that's what happens.
Dr. Haley, why don't you wrap us up for the human side of healthcare for this year, and just again, based on your experience and as you ponder what the next 12 months might hold for this virus and for us collectively, what could you take us out with for some advice for 2023?
Well, I'm hoping what we're going to see in the coming year is this virus becoming less virulent, and even though it's going to infect a lot of people, it might become something we can live with. And certainly I would like to see a much broader group of people in our country, great majority of people become vaccinated, so that we know, even if it comes back in a more severe form later, that we would be pretty resistant to it. We would have true herd immunity from vaccine. You know, the concept of herd immunity has been very much misunderstood. Herd immunity, that is the ability of the entire population to be resistant to a virus or a bacteria or something, so that it can't spread. That's the concept. But herd immunity has always been talked about in terms of being produced by vaccines. That is a safe way to make a whole population resistant, so that something can't spread. The idea that herd immunity would be produced by letting everybody get a fatal infection is a new idea, and a very bad idea. And so that's something I hope we'll remember in the future, that the way to beat these viruses is support our agencies that do basic research, so we have the vaccine technology to produce quickly if we need it. If we get another pandemic in this upcoming year, or a revisitation of a virulent strain of COVID, we are now in a much better position to produce a vaccine quickly and vaccinate the entire world. And what I hope to see is that we realize that that really is a good thing, and that we would support it just to prevent so many people from dying.
Dr. Haley explaining COVID like nobody can. He's the head of epidemiology at UT Southwestern Medical Center. Steve?
Thanks for joining us today. As you know, we're entering our third year, and we want to say in 2022, we're going to beat COVID. Have a safe rest of the weekend, and we'll see you next week on the Human Side of Healthcare.